I agree to having this health assessment recorded and videotaped.
All right, I'm going to start by foaming my hands. All right.
Hi, my name is Emily. I'm going to be your student nurse today. I'm going to be doing a gas exchange focused assessment. Is that okay if I proceed?
Yeah.
All right, and you feel comfortable with privacy and everything?
Yeah.
Okay, all right. I'm going to start by inspecting the patient's thorax. I'm going to start by looking at the anterior thorax. The breathing is unlabored and quiet. There's no accessory muscles being used. The skin is pink in color all over. There's no notable masses or lesions. There's no pursed lip breathing or nasal flaring. I'm going to go ahead and have you turn around for me, sir. All right, now looking at the posterior thorax, I don't see any masses or lesions. The skin color is even all over. The spine is straight. Again, the breathing is unlabored and quiet, and the accessory muscles are well developed for the patient's age and occupation. Now I'm going to go ahead and palpate the patient's posterior thorax. So let me know if you feel any tenderness with any of this. Okay. All right, there was no notable tenderness or masses, and there was no abnormal firmitis in any of the areas. Now I'm going to check for symmetrical chest expansion, so I'm going to have you breathe for me, please, sir. All right, and the chest expansion was symmetrical. Now go ahead and turn around for me, please. I'm going to do the same to the front, or the anterior chest. So I'm going to go ahead and palpate again. Let me know if there's any tenderness with any of this. All right, and there was no noted tenderness or masses while palpating, and the firmitis was, there was no abnormal firmitis. And now I'm going to check for symmetrical chest expansion, so go ahead and take a breath for me, please, sir. All right, and the chest expansion was symmetrical on both sides. So now I'm going to go ahead and percuss the anterior chest. All right, there was resonance in all areas of the lung fields. There was no noted dullness. Go ahead and turn around for me, please, sir. Now I'm going to percuss the posterior thorax. All right, there was resonance in all areas, and there was no noted dullness. Now I'm going to go ahead and auscultate the patient's lung sounds. I'm going to start by first foaming my hands. And then I'm going to go ahead and clean my stethoscope. Right. All right, I'm just going to go ahead and listen to your lung sounds. I'm going to have you breathe out in and out of your mouth for me, please, sir. I'm going to start at the apex of the lungs, which would be vesicular lung sounds here. All right. This would be bronchovesicular lung sounds. Good, and this is vesicular lung sounds here. Good, vesicular lung sounds again. this is all vesicular lung sounds down here as well. Good, there was no adventitious lung sounds noted. Go ahead and turn around for me, please, sir. All right, I'm gonna go ahead and listen to the anterior lung sounds, starting at the apex of the lungs, which would be vesicular lung sounds here. Good, this would be bronchovesicular lung sounds here. Again, bronchovesicular lung sounds here. Vesicular lung sounds here. Good, and there was no adventitious lung sounds. And now I'm just gonna go ahead and take my patient's respiratory rate. Can you go ahead and bring your arm up over your chest for me, please, sir? Thank you. All right, my patient's respiratory rate was 14. All right, thank you.